Now we're going to go over an approach to the bleeding dialysis fistula. The first thing you want to do when someone comes in with a complaint of a bleeding fistula is you want to gown up, because you never know how much they're actually going to be bleeding. So make sure that you have a face shield and a gown so that you don't get dirty. Next, this is a two-person job. The first person obviously puts on a pair of gloves, and they're going to get proximal and distal control of the fistula. Just with their fingers, they're going to put pressure on it. While they're doing that, the second person is opening the bandage and seeing what's going on. Now, typically, they'll just see a small oozing hole, which is from the puncture wound from their dialysis treatment. If that's the case, then it may have even stopped bleeding already, which is fine. The first thing you want to do is you want to create a see-through pressure dressing. So you take one of the large central line Tegaderm dressings and you take one gauze pad. The idea of creating a pressure dressing is that the smaller the area, the more force you're going to apply over the bleeding hole. And because usually it's a very small hole that's bleeding, you don't need a giant pressure dressing. So you're going to fold up your gauze pad very small, and you're going to place it in the middle of the Tegaderm. You're then going to take one finger, find exactly where it's bleeding, and you're going to place it right over the bleeding spot. And then you're going to put down the Tegaderm tight. That creates a dressing which is not going to come off until the patient goes to dialysis again. You then have someone sit with one finger on the spot for at least 10 minutes holding pressure. Once that's done, you can put an additional pressure dressing over that using extra gauze and using an elastic bandage. Usually that takes care of the problem. If, however, the patient has a larger bleeding tear or an aneurysm, something that's not going to be fixed by just a small pressure dressing, then you can advance to figure of 8 suture, a tourniquet, but that will be only with the guidance and help of a vascular surgeon, because you can ruin the fistula and that needs their involvement. That's it.